next speaker الأستاذ الدكتور مازن عن هزاع. تفضل.
بسم الله الرحمن الرحيم. السلام عليكم. أساتذتي وزملائي الأستاذ محمد، الأستاذ العواد، الأستاذ الكاظم. السلام عليكم ورحمة الله وبركاته. اسم الفايل الشفاء. كلفت أن أحضر موضوع في هذا المؤتمر لعودتنا تستشهد الشفاء كل سنة عليه، واحتاريت في أي موضوع أختار، فاختاريت very common problem in our society، مشكلة كبيرة تتكرر لدينا يوميا في حياتنا السريرة. Explanation why I had shortness of breathing, they told him that we have some psychological upset. And until the patient progressively deteriorated, they get right-sided pleural effusion, then deteriorate to bilateral pleural effusion, and considered as a case of respiratory problems, and kept them on antibiotics and treated as a case of viral pneumonitis. But progressively, unfortunately, the patient has died, and actually what he died from a problem what is called heart failure with normal ejection fraction, with preserved ejection fraction. So the heart failure is very important subject, and it is very common in our society. يعني احنا يعني كل شوي نشوف heart failure. The previous thought in the heart failure is low ejection fraction. Ejection fraction less than 50 is heart failure. بس المشكلة يجي المريض with full blown pictures of heart failure, بس ejection fraction مالته normal, okay? And it is not treated properly. And heart failure with reduced ejection fraction, المانجمنت كلش واضحة وسهلة للمريض، والمريض يصير له تحسن سريع. المانجمنت نقسمها قسمين: drugs to relieve the symptoms, and the drugs to improve, stop the progression of the disease and reverse the drawbacks of the heart failure. Well, the drugs that treat the heart failure is well known, and they improve the survival, like beta blocker and ACE inhibitor. But what about the heart failure with the preserved ejection fraction? Yeah, لسه طويلة من المرضى، يعني شفنا بحدود 10 إلى 15 مريض يمشي خطوتين ونفسه ينقطع عليه ما يقدر يطول. سوي له ايكو يطلع ejection fraction more than 65. But the diagnosis is heart failure with the preserved ejection fraction. أولاً السؤال how we can diagnose this? The diagnosis is very easy by using simple echocardiography, number one. And second, is there any hope for those patients? يعني احنا عادة يجي المريض heart failure with the preserved ejection fraction. التريتمنت تنصب طريقين: أولاً to decrease the heart rate، ما نخلي الهارت ريت patient intake cardiac state. The second is to relieve the congestion of the lung by giving him diuretics. But is there any hope to stop, decrease the progression of the disease and improve the survival? Yes, nowadays there is a hope. First, I will talk about the how we diagnose. How we diagnose heart failure is very simple diagnosis by using echocardiography and by looking to Doppler flow for the mitral valve flow. As you see, we have in mitral valve flow we have two waves. Height wave reflect the filling of the left ventricle. 70% of the filling of the left ventricle is spontaneous, just by the gravity. Once the mitral valve is open, the blood is getting down from the left atrium to the left ventricle. And only 30% needs arterial contraction to evacuate the left atrium to the ventricle. So we have two waves. The first wave is called E wave. This indicates the spontaneous filling of the LV, while the A wave indicates the arterial contraction. It should be the A wave is taller than the A wave because the spontaneous filling should be larger than the active filling. But in such case, you see the ratio is reversed. The A wave is taller than the E wave. This means the arterial contraction and the active filling of the LV is more predominant than the spontaneous filling, and this indicates LV diastolic function. However, this is not always clear, so sometimes we depend on tissue Doppler echocardiography is the same. Looking to the movement of the mitral valve annulus. The heart is not moving just by simple process, contraction, relaxation, يعني the fibers getting longer and taller. We have 3 types of fiber. Longitudinal fibers contracting like this, and you have circular fibers contracting like this, and we have oblique fibers, the apex of the heart, the base of the heart. The apex is moving in clockwise, where the base of the heart moving in anti-clockwise. فحركة الهارت تصير longitudinal, circular, and clockwise and anti-clockwise in order to evacuate the LV. So this tissue Doppler reflects the longitudinal contraction of the fibers, and this also we have two waves. This E prime wave, and this is the other wave. This in E indicates the spontaneous filling, and this indicates the active filling. As you see, the active filling here is more than the spontaneous filling, and this indicates the LV diastolic dysfunction, that is heart failure with the preserved ejection fraction. So the main topics بالسرعة ما نطلع عليكم. شنو الهوب الجديد? What is the new hope for treating such a patient? The new hope understanding the metabolism of the glucose. About 180 grams of glucose is passed through the glomeruli, down to the tubules and in the urine. However, about 90% of this glucose is reabsorbed from the proximal tubules by presence of a special transporter because sodium glucose co-transporter 2, and we have another one is present in the distal tubule that reabsorb the 90% of this glucose. This reabsorption of glucose in exchange with the sodium. So by using special type of inhibitor to inhibit this LGL2, to inhibit this transporter, what happens? The glucose is not reabsorbed and passes the urine, and so the patient getting glycosuria, and the patient getting well-controlled blood sugar. So this drug, your LGL2 inhibitor, is used for treatment of diabetes, but actually it does not cause a good glycemic control. By unknown mechanism, it is found that this inhibitor had great influence on the heart and on the survival of the patient. And we see the patient getting larger survival rate with decreased duration of admission to the hospital and deterioration in the heart failure. The mechanism is unknown. It caused retention of the sodium. In spite of this, it improved the patient with heart failure, whether preserved or reduced ejection fraction. So nowadays, these new inhibitors is used not to treat diabetes. It's used even in non-diabetic patients. When the patient has LV, systolic dysfunction or diastolic dysfunction, and it has improvement in the 5-year survival, improvement in antagonize the remodeling of the heart, and decrease the duration and the frequency of admission to the hospital. اكو داتا عديده توضح هاي الارقام بالمالتي سنتر درايرز، بس انا ما بدي ادخل بيها، بس الخلاصه انه this is the new hope for the patients with the heart failure with preserved ejection fraction or patient with reduced ejection fraction. Thank you very much.
شكرا جزيلا.